Heavy alcohol use causes numerous diseases and disorders that affect the brain, nerves, muscle tissue, heart, stomach, liver, pancreas, and other organs also. Consuming the substance is a risk factor for several cancers and it associated with physiological disorders. Alcoholism is a type of disorders. The National Council on Alcohol and Drug Dependency and the American Society of Addiction Medicine define alcoholism as a primary chronic disease characterized by impaired control over drinking, preoccupation with the drug alcohol, use of alcohol despite adverse consequences, and distortion in thinking. There are several therapies for chronic alcoholism are there, but disulfiram is the only one drug therapy which is the first choice of alcoholism treatment. So, at first we have to know what is disulfiram. Disulfiram is a medicine used in the long-term treatment of a patient with alcohol misuse. Its chemical name is tetraethyl thiouram disulfide. It produces extremely unpleasant reaction in a person who ingests even a small amount of alcohol while he or she taking disulfiram at the same time. The knowledge that taking alcohol will be unpleasant serves as a reinforcement or additional support to their decision not to drink. It also protects them from giving into sudden urges to drink or pressure from friends. It is supplied in tablets of 250 mg. The usual dosage range from 125 to 500 milligram per day. The dosage should not usually exceed 500 mg per day. It should be taken before bedtime to avoid drowsiness in the daytime. Now, how disulfiram metabolized into our body? Disulfiram is a completely absorbed from the stomach after oral administration. Then it broken down in the liver and excreted through urine. What is the mechanism of action of disulfiram? Disulfiram causes aversion therapy towards alcohol intake. Disulfiram inhibits aldehyde dehydrogenase and causes accumulation of acetaldehyde in the blood and tissue. The sign and symptom include nausea, vomiting, flushing, hot feeling, headache, sweating, tachycardia, palpitation, breathlessness, chest pain, hypotension, hypoglycemia, confusion, shock, and even death. This reaction is unpleasant, hence person on disulfiram develops aversion to alcohol. Drugs like metronidazole, grisofulvin, cifoperoxone, etc. also have disulfiram-like action and produce similar reaction with alcohol. Doctors should warn the patient not to take alcohol when they are on the above mentioned drugs. There are some side effects of disulfiram are disulfiram in the absence of alcohol can produce in 40% people lethargy, drowsiness. In case of 40% decreased memory loss, headache for 35%, itching in 33%, decreased sleep in 27%, dizziness in 22%, and sexual problem in 10%. There are also peripheral neuropathy, tingling and numbness of hands and legs, worsening depression and psychosis in some patients. Less than 10 patients out of 100 taking disulfiram developed serious side effects which required withdrawal of the drug, immediate action.